Shoulder range of motion, shoulder flexion. To begin, have your partner laying on his back in the supine position with arms extended at their sides. The axis of rotation is the greater tubercle of the humerus. The stationary arm is parallel to the thorax, and the mobile arm is along the midline of the humerus. The normal range of motion for shoulder flexion is 180 degrees, which is demonstrated here. Ankle foot range of motion, ankle plantar flexion. Have your partner seated on the mat table with their legs dangling off the table. The axis of rotation is the lateral malleolus, and the stationary arm is aligned to the fibula. The mobile arm is aligned with the fifth metatarsal. Normal range of motion for plantar flexion is 45 degrees, as demonstrated here. Spine range of motion, thoracocolumbar side bending double inclinometer. Have your partner standing upright and palpate T1 and place your inclinometer over this position. Be sure to zero out the inclinometer so the arrow is pointing to the side of the fluid bubble. Next, palpate S2 and place your second inclinometer on this position. Have your partner bend to the side. The measurement of the side bending will come from the difference of the two inclinometers. Normal range of motion for thoracocolumbar side bending is 25 degrees. Here you see 35 degrees. Shoulder manual muscle test, latissimus dorsi. Have your partner laying face down with their arm by their side, palm up. Stand by the side of the arm being tested and assess available range of motion. Place one hand on the proximal to the wrist joint and one hand proximal to the elbow. Have your partner reach his arm downward towards his feet. Resist in the opposite direction by trying to push the arm upward. Here she receives a manual muscle test score of 5. The latissimus dorsi originates in the spinous processes of T7 through T12 and inserts the intertrabecular groove of the humerus and performs adduction, extension, internal rotation, horizontal abduction of the glenohumeral. Hip manual muscle test, iliopsoas. The iliopsoas originates both at the iliac fossa and the transverse processes of T12 through L5 and inserts at the lesser trochanter and performs hip flexion. To begin, have your partner seated on the mat table with his feet off the ground. Instruct your partner to lift up the testing leg into hip flexion and assess the range of motion. Place your hand just proximal to the knee joint and resist downward. Demonstrated here is a grade 4 manual muscle test. Spine manual muscle test, rectus abdominis. The rectus abdominis originates in the pubic crest and the pubic symphysis and inserts at the xiphoid process and cartilages of the ribs 5 through 7 and performs trunk flexion. To begin, have your partner lay supine with his hands clasped behind his head. Instruct them to curl up and see how far they can go. A grade 5 for the manual muscle test is seen when the hands are clasped behind the head and the inferior angle of the scapula is cleared on the table. A grade 4 is demonstrated when the arms are crossed the chest and the inferior angle of the scapula is cleared. And finally, a grade 3 is demonstrated when the arms are straight out in front of you and the inferior angle of the scapula is cleared, demonstrated by this motion here.